This eHIV Review Patient Voices program is presented by DKB Med Radio. Women, HIV, and pregnancy. It began as gay flu, then gay cancer, and then acquired immunodeficiency syndrome, AIDS. It quickly became an epidemic, feeding a panic of fear, disinformation, ignorance, and hate. The original CDC definition of AIDS focused primarily on gay, male-specific symptoms and the use of healthcare resources. The 1993 revision included female-specific conditions, which more than doubled the number of women considered infected and eligible for HIV healthcare benefits. And the focus then turned to pregnancy and avoiding mother-to-child vertical transmission. Breastfeeding became the new battleground, a face-off between science and laws intended to reduce transmission. Breastfeeding mothers were arrested. Many lost their children to protective services. Until medical advances leveled the playing field with the advent of U equals U. This issue of Patient Voices is a companion piece to our recently published eHIV Review newsletter and video podcast on assessing strategies to reduce perinatal and postnatal HIV transmission. Our Patient Voices guest today is Kim Canady. She was born HIV positive and lost both her parents to complications of AIDS at the age of 9. Kim is a sexuality educator and HIV AIDS advocate with over 20 years of experience in human sexuality and public health. She joins our host, Justin Alves, a nurse and nurse educator at Boston Medical Center, and our eHIV Review nursing program director, to share her story. And now, Patient Voices.
Hi, everyone, and welcome to eHIV Review's Patient Voices series. My name is Justin Alves. I am the nursing program director for the eHIV Review series, and I am joined today by Kim Canady, an educator and public health consultant who has an expertise that we're looking to talk about today as a person with HIV who identifies as a woman. Hi, Kim. How are you today?
Hi, Justin. Thank you for having me here, and I'm doing good. Can't complain. Well, I can, but ain't gonna change nothing, so yeah.
Sometimes it makes us feel better, though, you know? So today we are focusing on the care of women with HIV, and I'm wondering if you want to tell us a little about yourself, your journey with HIV, and how this all sort of started for you.
Okay, sure. So I guess we start at birth. So I'm a person who identifies as a dandelion, also known as a lifetime survivor, those who were born with HIV. So for me, actually, Sunday just made 39 years of me being positive, and I guess that's where it started. Just birth. I knew I was different. I knew I wanted to know more about HIV. So growing up with HIV, it was a secret until I got older, and I decided that I wanted to not be in the stuff. I really did not want to be who I am today. This was not the goal. I thought I was going to be somewhere singing somewhere. I really thought that was who I was going to be. Did not imagine me being an AIDS activist because I just had questions. Kind of got thrown into everything with me going to the doctor all the time, me asking questions. My sister had me go with her to different places because both my sisters are social workers. Sister was a health educator at that time, and I would follow along. And when I needed a job, they remembered me, and I got hired, and the rest is history. I've been working at different places and consulting. I'm a pleasure activist. I believe that HIV should be joyous. Sex should be joyful, should be pleasurable. I also feel like my population with lifetime survivors are a forgotten group where, it was a big deal because babies were being born. And then once the transmission rates became lower, everybody kind of forgot about the ones that was already born. So a lot of my mission is to make sure that we are visible, that we do have rights, we are seen, we are heard, our stories are not forgotten, those who are here and who aren't, while also living life and not just existing.
And, you know, happy belated birthday.
Thank you.
Um, but I think what's what I'm hearing from your story that is really interesting and I'm interested in is sort of the change that you might have seen throughout your lifetime, right? Because HIV has certainly changed a lot. I mean, it's changed, I think, probably most significantly for people who are pregnant. And I know a little bit about you. And so I'm wondering if you can share a little bit about your journey to getting your family and having a family of your own as a mother and what that was like for you.
Sure. So, at so I feel like I'm aging myself, but I'm so young. But they call me the old auntie. Because I'm 30. I'm 39. Jesus, I gotta keep saying 39. I'm 39, but as well as being born in the 80s and then rising up as HIV was rising up and we're learning about that. I'm growing up with HIV. And at that time, this was, I want to say the early 2000s, we wasn't hearing people were having babies. So for me, I didn't want to have kids. I just knew that I didn't want to pass over that same experience with living with HIV to my child at that time. And then what changed was somebody from the clinic had got pregnant and had a baby. And for us, it was like Santa Claus. It was like, oh my God, a unicorn. How did this happen? So we're all asking, like, out of curiosity, but also like it was that peak of that joy, the peak of hope that came that we too could have babies because it was for so long they told us that we wouldn't be able to have any children without passing on HIV. So she gave me that little bit of hope. My husband, um, he was like, "We're gonna have a whole bunch of kids. We're gonna have like 12 kids," and I'm like, "Not with me, but maybe two." And it came down to one. Um, but yeah, talking to my doctor, my pediatric doctor he was amazing. So anytime I had questions, I brought my husband in. At that time, he was my boyfriend. Um, Talked to my doctor. My doctor was like, yeah, you can have children. This is what the process would look like. Um, I was, again, scared to have kids. And my husband was like, if you get pregnant again, we're, this, this is this is what we're going to keep the baby. And I said, we're going to keep the baby. And I didn't think that I was going to get pregnant because I was on birth control. And I wound up getting birth control. Wound up getting pregnant on birth control. Was very mad. Was like, this isn't working. How did this happen? And yeah, now it's almost 16 years later, and I got my son will be 16 next month.
Yeah, I mean it's like an amazing story, right? And I think that spark of hope that you talk about, seeing somebody else do it first,
Yeah.
I think is super joyful. I'm wondering if you can talk a little bit about what happened after delivery, decisions about breastfeeding and raising your son and all those things. It feels very charged to talk about that right now. With some of the new scientific data that we have, there's a lot of old school thinking that's going on. And I'm wondering if you can shed some light on what it was like for you as a new mom.
Okay. So I gave birth in 2010. I feel like let's set the scene. 2010, it was very strict on we cannot breastfeed our child. Um, if you do breastfeed, then you will ACS at that time, or Child Protective Services (CPS) will get called. Your child will get taken away from you. Do not even think of putting that nipple to the mouth. Like it was very clear that we could not do that. And for me, it's like and my friend said it. She had the words to say it, and it's like my body is safe enough to give birth, but I'm not safe enough to then breastfeed my child. So a lot of us we lived in that fear. I could speak for me. I lived in the fear of, all right, I just want to make sure my baby is born negative, and I don't want to put anything else in jeopardy. At that time, it wasn't even about me and how I felt. It was I don't want to hurt this baby. I don't want my baby to grow up positive. So anything that they told me to not do, I was not doing it. Because it was I think it was a different feeling because I was born positive and I knew what it felt like to not be alone, but felt like the odd man out because even though I was around people who were HIV positive, not everybody was born positive. So that connection wasn't there. And even now, when we all get together, it's not really trauma bonding. It's like bonding through trauma. And it's a different feeling. So just giving birth and walking through those different processes was lonely at first. Like my husband was here. I'm not even gonna take it away from him. And I was pregnant with two other of my friends. It wasn't on purpose. It was not one of them pregnancy things. It just
Wasn't a pact.
it was not a pact. Trust and believe. We all were like, "Oh, you pregnant too?" Oh, everybody was just having sex and getting pregnant in 2009. It's kind of like the pre-COVID babies. But yeah, all three of us were pregnant at the same time, and had our babies all around the same time. So it was a point of reference for us where we would all like kind of, if we were confused, we would hit each other up in some kind of way. And I will acknowledge my privilege. I live in New York City. So in New York City, it's not like living in rural Alabama where getting to a clinic was rough. I worked at my clinic. So I was in proximity. I worked with my doctor. So I was with my doctor and also another teen clinic that helped me. Any questions I had, it was accessible. It was just the after part of being a new mom and going to all those visits and postpartum and not knowing what postpartum was fully at 23, at that time 24, was something that yeah, you look back at and it's like I wish I had those tools. I wish we talked about that more.
I'm struck as you're sort of wrapping up here about the conversation, about your statement about your body being safe enough to deliver an infant and then being told that it wasn't necessarily safe enough to feed your infant. I mean, sort of the moral injury probably that comes with that. And so I guess my question for you is like, what are the things that you think providers need to know about caring for women with HIV to really prevent some of those moral injuries from happening? What are some things what are your key takeaway messages for us so that folks have a better understanding of how best to serve this population?
See me as a whole person. And when I mean that, I mean my life. Okay. Some people take away the HIV and just look at, well, first off, I'm a Black woman, so I'm already on the bottom of the totem pole when it comes to giving birth because we are at the highest rate. Women are not living, just giving birth. That mortality rate is insane. Add HIV to it, add Black to it, then it's another, I'm getting ignored even more. And then add HIV to it, I'm just incompetent, is how I feel when we go to doctors. So listen to me. I am the expert of my body. I have been living with this virus for 39 years. I have been the one that has been in control. And sometimes I feel like I know more than what the doctors, because I know my body, because I was trained to know my body as a child. So take that time, listen to my story, listen to what my experiences are and what my fears are, and don't dismiss it. And let's work together. And I think that's a big part is that most doctors don't want to work together because either ego or because out of fear of how HIV used to be in the past. And a lot of people are stuck in their ways, and I'll say for patients as well. But at the same time, if we can come to a common goal, which is make sure that baby comes out safe and make sure that mom is still alive and she's safe, I think that patient care treatment would go a long way, especially with that empathy part.
Yeah, I mean, I think you hit the nail on the head. I think like listen to women, believe what they tell us when they come into the office. And I'm so grateful that you were able to share your story with us today. I think it's a powerful story. I think the things that you sort of elucidated for us about your care experience and about trying to give birth and have a baby and have this lovely family that you have are powerful. And so thank you so much for being with us today. And I hope that we hear from you in the future.
Thank you for having me.
And thanks to everyone listening. My name is Justin Alves with Patient Voices at DKB Med's eHIV Review. We were thrilled to have you with us today, and we hope you join us next time.